Hey, so hello and welcome to another episode of Grief Unedited. Now, this is a space where we have real, honest, and raw conversations about grief and loss. I'm your host, Karen Lafferty, and I'm an accredited counsellor specialising in grief. And I've been working with people for over a decade to help them navigate their journey through loss. If you do want to connect with me, I'm on Facebook and Instagram, and both of those are at Continuum Counselling, or my website is continuumcounselling.com. Now, I always start by saying that this episode and the podcast in a whole is just for educational purposes, so the views that are expressed within it are my own, and they don't represent any of the third parties that I work with or on behalf of. And lastly, I do always give a content warning ahead of the session, just because we know that grief is overwhelming often, and it can bring up lots of unexpected emotions. So if you're listening today and there's anything that doesn't feel helpful for you, that's fine. Feel free to click off and you can come back whenever the time might feel right for you. So today's episode is going to be a little bit different. I've got an amazing guest today that I'm really excited to get into this conversation with. And today we're going to be talking a wee bit about the idea of how our GP might be of use to us when we're grieving or when bereavement is in our world. And my guest today is Dr. Suzy Peach. And before I get your introduction, Suzy, I just want to acknowledge I think you get the award for the coolest name so far in my podcast. Like that's just beautiful, Dr. Suzy Peach. I was thinking before we came on, if I had a cool name like that, I think I would just go about introducing myself all the time. Like, hi, I'm Dr. Suzy Peach.
That's true, actually. And I always said, the feminist in me always said, if I get married, I'm never changing my surname. But unfortunately, that surname was too tempting, so I changed it.
Nice, nice, beautiful. So tell us a bit about you, Suzy. What's your background? What do you do?
Sure. So I am a GP. I've been a doctor now for almost 14 years. I have a special interest in, I would say, both ends of the spectrum. So pediatrics and death and dying. Might seem a bit odd to say that's my special interest, but I'm very passionate that we get a say about almost everything that happens in our life. So we absolutely should have a say in what happens at the final stages of our life too. And that's where it's kind of come about from, I guess. I am also now, I've started a business with my husband. We are developing a health and wellbeing education platform. And the point of this is to try and promote more open and honest conversations about everything to do with health, including death. Because we, as a society, we're just not talking about these things enough, really, or we're talking about them in a way that's not honest enough, in my opinion. There's a lot of information out there on social media, particularly for young people, but a lot of it is not true and not accurate. And we're trying to myth bust a lot of the content that's there and just try and have more open and honest conversations.
Beautiful. And you know, just thinking that's how this podcast came to be as well, is that I have a few friends who all had their own significant bereavements, and that was what they said to me, was that there was lots of content out there about death and dying, but you could tell that a lot of it was really quite heavily scripted, or it was pushing a
Mhm.
certain agenda, but there wasn't so much about just the reality of loss, you know, that real heartache of somebody you love dying, and what is that like for us on a day-to-day level. So yeah,
Sure.
I'm excited to see what you do with your platform and what unfolds from it, because I think you're so right that the conversations are happening, but are we actually talking about what we need to be talking about?
That's it. And I think with the internet and social media, we have access to so much information, but we don't always know what to do with that information. So the point in our platform that, well, basically is aimed at teenagers and parents and schools.
Mm.
And it's to kind of raise everyone's health literacy, that being the kind of buzz term for how much you know about health.
Mm.
So we go right back to basics. We talk about the fundamentals of nutrition or exercise or your organs, your sexual health, your mental well-being, all the kind of normal stuff that I think really and feel really passionately that everyone should just know.
Yeah.
And if we all have a better baseline, understanding, we can have better conversations when things aren't going so great. And we can place, when we come across information that's just a snippet, we can place it better if we understand we have that foundational knowledge behind it.
I'm just thinking I have a niece and a nephew on both sides of our family that are 14, and it worries me that a lot of the information they're getting about what's normal and not normal, do you know, how to grow up is coming from TikTok, and yeah,
It
it does worry me the influence that has on them.
True, true. There was a study done last year, actually. Sorry, this is me going off on a tangent, but there was a study done last year. My Fitness Pal teamed up with, I think it was the University of Dublin, to analyze TikTok for posts about nutrition. So they used an AI algorithm. They analysed all the posts that were there at that particular point in 2024, and they found that 98% of them were inaccurate. So only 2% is accurate. And you just think, how can all of us really trust what we're seeing and what we're hearing? And that can be quite dangerous for the experiences that we do then have.
Yeah. Gosh,
Yeah.
that's wild. 98% is inaccurate.
Crazy, isn't it? I mean, that's just nutrition, so I don't know what else could be going on out there. So we need to, I think that's why I so passionately felt there's a better way for me to help young people here on a kind of grander scale. I found myself in day-to-day practice, I was having the same conversations over and over and over, and I thought there has to be a better way to just give people really trusted information and knowledge straight from the experts, and that's kind of where it started, and it's grown arms and legs since then.
Beautiful. I know you're relatively on in your journey of that, and the kind of the start of it's just kind of blooming. So yeah, I'm really excited to see what that grows into and where you develop it to.
Yeah, thank you. We're launching this month, which is a bit scary.
That's exciting. Yeah, yeah. Well, the reason I wanted to have this conversation today is that I suppose I'm just very aware as a grief counsellor, there'll be people that I work with who, for different reasons, we get to a point in our sessions where it becomes apparent that they might need a little bit more intervention than just talking support. So we might
Yeah.
get to a place in our relationship where I'm suggesting, I think it would be good, or it might be an idea to have a conversation with your GP about some of the symptoms that they're experiencing as a result of their loss. And I notice that often what I get in response is that reply of, well, what can my doctor do? They're just going to prescribe antidepressants. So I really wanted to open this up to hear from you on the other side of that. If you had somebody coming through the door who was relatively newly bereaved, was a bit worried about how they were coping, what might that conversation look like?
I think, yeah, brilliant to talk about this, because it's funny how, people come in with particular ideas about what we do. First things first, I believe that human connection is more important than anything else. So if you leave that consultation with nothing but a feeling of connection with me or your GP, that's a good start. At that moment in time, there might be nothing medication-wise that can be done, and often, actually, we don't want to go down that route with bereavement. I'll talk about that again in a second, why. But knowing where someone is at is really, really important as a kind of starting point for us to work forward. We don't know if any of our patients are struggling unless you come in. We've got no idea. Now, that brings me to, I know you were saying if someone is recently bereaved, but actually I would prefer if they came in, but as long as it's not a sudden unexpected death, if they came in beforehand, and
Okay.
just let us know. It's common, especially in smaller practices, and I was blessed with the practice that I worked in. It was a small practice, and if we knew that one of our patients had a relative or a close friend or a partner that was nearing the end of life, we would usually discuss that so that everyone knew.
Oh, wow.
We
Okay.
talk about it over coffee. We'd be like, FYI, Jimmy came in and his wife's dying. She's not a patient of ours. So you might not know necessarily if it's not a patient of yours, but also if it is a patient of yours that's dying, you tend to know all the family. And it's good to have a heads up. And the reason is, you might not need something right now, but in a week or a month or a year, you might. And that thing might not necessarily be something to help with your mental health, but it could be something to help with your physical health.
Yeah.
It's so important to never forget that stress, emotional stress, affects your body on a physical level as well as on a mental health level, and that might manifest with a physical health problem later on. It will help us with our diagnosis. That person is not having a heart arrhythmia, they're having palpitations because they're under long-term stress or whatever it may be. It helps piece it together. And a huge part of what we do as GPs really is just to listen, and to make that connection and that relationship. And that can be really tough in a 10-minute consultation.
Yeah.
But it's not just a one-off spot 10-minute consultation. It's you can come back. You know, that conversation develops and that relationship develops over time. And I would always urge people to go and just say to your GP, you know, I'm struggling, I'm worried about this, I'm going to lose someone, I don't know where to start. The other thing to say is we don't one of the nice things about being a community GP is you know what resources there are locally.
Yeah.
So as an individual, you might not have a clue where to go with this, and you just go to the GP and they say, right, okay, you know, how are you feeling? Talk me through it. What's this going to mean? They will be able to signpost you to services that there are locally. There might be counselling services, there might be financial support services, there might be legal services that you might need
Mm,
to tie and put everything together and pull everything together. So, um, yeah, it's a good starting point. And don't I would just urge people, if someone is telling you that you should go to the doctor, have a think about it. Do you feel comfortable doing that?
mm,
It is easier to do that when you already know who you're going in to see, and
yeah.
that is why I think going in the kind of anticipatory stages is powerful for later on, because once you're at crisis and once you've lost that person, it's harder to advocate for yourself and to speak well and explain how you're feeling when it's so acute and it's so new and it's so fresh.
Mm,
And having a relationship that's already there with your GP is really going to help at that time.
mm,
Medically, what we can actually do, I mean, I know it's funny you saying, you know, what are they going to do? I kind of see why someone would say
mm,
that, to be honest, because yeah, I one of the GPs that trained me years ago always said that there is more in the doctor-patient relationship that's therapeutic just from having a conversation than there is in the medicines that we actually could ever give someone. And that's true, and I don't know why. I think it's true. I don't think we can measure how important it is to make another connection with someone, but, yeah, so there's a lot to be said for that, that I can't explain.
mm,
Medically, like I said, it could be, you know, it could start and trigger some physical problems. Mental health-wise, obviously, you know, the grief reaction and the emotional stress that someone is put under is a normal emotional response to something really rubbish happening. That's not a medical thing in a way, it's a human response and it's natural and it just shows the loss and the love that you had for someone. Um, we don't like to medicate that because it's not okay. Um, it's, you know, if someone needed a little bit of something, there are some things we can give for short-term anxiety relief just to help someone get through. Yes, that's a possible conversation if someone's struggling, so by all means go and ask. What we know is when someone is going through any emotional stress over a prolonged period of time, i.e. several months, um, that does change chemically what goes on in your brain.
mm,
And that is where emotional stress to something that's stressful, i.e. a normal response when life's a bit shitty, that is can become abnormal when it's prolonged. And that can lead to, as I say, chemical and cellular changes actually in the brain. And that can lead to a reactive disorder or a depression.
mm,
And they're the kind of things that may need medication later on, but often can be helped with talking therapies.
yeah.
And often the first step to talking therapies, be it from counselling up to psychotherapy, is accessed through your GP anyway.
Mm,
So in going to the GP, I guess you're opening the door for a future relationship when things might get worse or might get better, and also possible medications, but more importantly, possible talking therapies. The other thing, of course, we can help with is assessing your fitness for work.
oh, yeah.
You know, that's huge, and it might be that we need to help fill out paperwork for something, some legal document you've had, or sign you off work for a short period of time. These are all things that are easier for us to do when we understand your circumstances, and
Mhm,
that is why, again, coming in earlier is better. Better for us, but also better for you.
yeah.
When someone comes in, I'm just rabbiting on here now as the ideas are coming to me, but when someone comes in for a consultation, we are all now taught, I don't know when this started in GP training, but certainly I was taught it, something called ICE. Now, I cover this in the course because I think it's important for people to know, because when we ask these questions, they're often met with, what are you talking about? Like, you're the doctor, you're supposed to know. Now, it stands for ideas, concerns, and expectations. So we ask questions like, what can I help you with today? It's very open, because I don't like to put words in people's mouths. We let them speak for themselves. And then ideas would be, what do you think is going on? Now, I know this isn't really relevant to the bereaved topic, but a lot of people hate that because they're like, what do you mean? What do I think? It doesn't matter what I think. What do you think? Actually, it really does, because if you've gone online and you've read about, I'm trying to give an example when it comes to bereavement, but you've read about a particular medication. Maybe you've read about diazepam, and that's what you're supposed to come and ask for, right? That's your idea. I've just lost someone, so I get diazepam. I go to the GP and I get diazepam. That's my idea of why I'm here. Your concerns. So is there anything you're worried about? I don't think this is really relevant to these types of consultations, but for example, if you had a cough for, I don't know, a couple of weeks, and you've lost someone to lung cancer. That's different from an 18-year-old who's just had a cough for a couple of weeks and has never known anyone to have ever had any lung pathology. So it's useful for us to know if there's underlying worries with you, because otherwise you'll leave that consultation and you won't feel satisfied because the doctor hasn't actually addressed what you're actually there with, because you didn't tell us. And the last one is expectations. What do you want out of this consultation? And I think for bereavement purposes, sometimes there might be something that you want. It's okay to ask the doctor that. Say, I would say, hopefully I always remember to ask, but is there anything in particular you were hoping I could do today? Some people don't know, and that's okay. And especially when it comes to an emotional consultation like this, you don't always know what you're there, why you're there, or what the doctor can do for you. That is completely fine. But again, if you come in with a particular agenda or something you're hoping to get out of it, it might just be that you've come and you've spoken for 20 minutes about losing someone, and I've listened, and you've left again, and then you're halfway home in the car and you think, oh, I forgot to ask for a sick line. So that's where the expectation part matters. Give us those ideas, those concerns, and those expectations up front. Otherwise, you're not going to get the best out of your consultation. And as I say, if you don't know and it's just coming in for a chat to let us know where we're at, that is also totally fine. It helps too if there's multiple family members at the practice. If one person comes in, we know, often, especially in smaller practice, the other family, so to expect. They might be struggling. Oh, they're sitting exams right now. That's not great. So it does really, really does help the more that you open up that consultation. I'm not saying you're going to come in and get a magic pill, but it is going to help your overall state of mind, I guess, to come in.
I guess as well, something I hear often, the practice you've come from sounds incredible, that there is that connectedness and people are having conversations. I think sadly more often than not, a lot of the people I work with are in positions where they can't get an appointment with their GP. It's sometimes 3-4 weeks down the line because they're not seen to be urgent or needing an immediate consultation. So it feels like they know they're going into that 10-minute appointment and there's suddenly this pressure of I need to tell you about my partner that's just died. I need to tell you I'm worried because I'm not sleeping and I keep getting these weird things happening in my heart and I'm not eating right. And it's they have this anxiety before they've even got in the door. And I sometimes suggest take a list, give them bullet points, because even if you can't explain each part, you can give the doctor the list and just be like, listen, here's the things that have brought me here today. I might need to come back for another appointment, but
2 points about that. First of all, the hardest bit, if it's in a busy practice, is getting your first appointment. So again, go early, go before it happens, go when you think something's, because once you're in front of that doctor, people go into medicine because they care, right? So once you're in the door and you're in front of them, it's going to be easier to have repeat consultations. They might even book it for you. There's always wiggle room within the day to accommodate that. So the other thing with that is give as much information as you possibly can to the receptionist. It might sound, people hate that. They're like, why are they asking what's wrong with me? It's none of their business. They're legally bound by confidentiality, the same as we are. If you walked into my practice and the receptionist knew your brother or something, They wouldn't even be able to say, "Oh, I saw Karen the other day," because
Right, okay.
that's not allowed, right? It's completely confidential. But equally, we train our receptionists to ask these questions.
Yeah.
They're not quite triaging, because that's not really a skill, but they're asking enough to get you the right speed of appointment, but the right type of appointment. Um, and it is important, like, if you feel comfortable, try and give them as much information as possible, because they will often, I mean, often you get a little chap at the door and they'll say, "Look, I know you're full today, but someone's just phoned and the mum's just died." And you're like, "Fine, no problem." You squeeze it in. So, the more information you can give, the more likely you are to get an appointment and go quicker. The list thing. So I love and hate a list. I'll tell you why. I'll tell you what list I like, because this will help people. Um,
Help me.
I like an actual list written that people come in with, written or on their phone, I don't really care. And I like them to tell me up front that they have a list.
Okay.
And what you can do with that is go through it quickly together and decide in that 10 minutes what the priorities are
Beautiful. Okay.
and book them back in.
Mhm.
Because that's where a consultation can become 2 or 3 or 4, whatever's necessary. I don't like a hidden list, and
Mhm.
that is, I'm gonna talk to you for 12 minutes about my hay fever. I'm gonna put my jacket on. I'm gonna be halfway out the door. "Oh, and by the way, I'm having these chest pains." And you're like, "Oh, are you joking me? Sit back down." It's frustrating because it obviously knocks us late, but it's frustrating too because you've just that person, I know why they're doing it, because 'cause they're not felt comfortable yet to open up, and it's totally normal and totally human, and I'm sure I'd be the same. But it puts us under pressure to then try and deal with the serious thing quickly, because
Yeah.
you now know that there's loads of people waiting in the waiting room, and we're not as good at making the decisions when we're under pressure.
Mhm.
So I don't mind running a little bit late, especially when someone needs it. That's fine, but it's good to know upfront
Yeah.
what is the true concern here. Now, I appreciate that's not always possible, especially if you're not comfortable and it's a new doctor and you gotta kind of warm up to them and find out, do you actually trust them enough with this information? But if there are several things to discuss, definitely write them down, because 'cause you'll forget in the moment, the doctor will forget in the moment, and actually it's really, really helpful tool to get the most out of your consultation.
Beautiful. That's great advice, actually. And yeah, I'll bear that in mind, because often I find I'm the one that's maybe doing a bit of coaching in the work that I'm doing, of like, okay, let's think about what needs to go on that list and how do you express how you're
Mhm.
feeling and what's important, what's maybe not so important. So yeah, good advice all round. And I've got one final question, if it's all right, just because again, sometimes I'll find that people will pluck up the courage and they'll go to their GP and they'll try and have the conversation, but for one reason or another, it maybe doesn't go to plan. I
Yeah,
sometimes hear people saying that they felt a wee bit dismissed, or they've had that sense of, well, the GP didn't think there was anything they could do for me, so they feel like they've come away with nothing. They've not had that connection that you talked about, of like,
sure.
we've
Yeah.
we've actually heard each other in the conversation. So if somebody walks away from a GP consultation and they don't feel like they've been listened to, or they've not had the support they were expecting, can we ask for a different GP? Should I come back to see you again? What would be the best thing to do in that situation?
I have no idea. I have no idea how to answer that, because it's so complex, isn't it? I mean, it's like it's a human to human interaction. So some people click and some people don't. Some doctors are better about and more comfortable talking about death than others are. There are patients that loved me and there are patients that didn't. And that's just part of the fact that we're all human and different people work for different people. So it depends on your practice. I mean, if you're obviously from a practice that's got several GPs, yeah, go again, definitely, and try and ask for someone else if you can.
Yeah.
Every practice is run independently and they're all run slightly differently. Most of the practices where I've worked, and certainly in my old practice, we had an on-call GP. So you had your normal, so every day was someone different. So you had your normal surgeries, but anything that came in on the day as an emergency, the on-call person dealt with. The others tried to mop up where they could, but that was their job that day. So if you wanted a particular GP, you couldn't phone in the day and say, I've got hay fever, can I have Dr. Peach today? No.
Mm.
Because or even if it was an emergency and they might say, "But I want Dr. Peach." You can't, because
No.
she's not the on-call. If it's truly an emergency, you get who you get on that day.
Yeah.
But for bookable appointments in advance, you can often ask for a different GP. Of course you can. You have your right to see whoever you like. That obviously is not applicable if it's a single-handed practice, there only is one GP. I would always say go back. I
Mm,
mean, give them the benefit of the doubt. Remember that your doctors, they're generally, most of us are good people. We're
mm,
trying our best. We are under a lot of pressure.
mm.
So that day where you felt dismissed, could it be that the doctor was just stressed because something has happened, or they were aware that, someone's just asked for another house call, and how am I gonna fit that in, and how am I gonna get to nursery to pick up my own kids after this? There's
Yeah.
things going on in their head too. They're
Mm,
trying their best to give, but sometimes, that's not always possible if we're a bit more burnt out. So, always go back and try and advocate for yourself again. There is absolutely nothing wrong with saying, I don't feel like you heard me last time. I
mm,
mean, if you feel comfortable saying that,
mm,
please say it, because that what a shocker to hear, and you think, "Oh god, right, okay, stop you in your tracks, you really do wanna sit and listen." Um, what is it you wanna get? It comes back to ideas, concerns, and expectations. If you don't feel like they were heard or elicited, you're not gonna be comfortable with your consultation, so think of it that way. If you
yeah.
go away and think, "Right, I heard that podcast and she talked about this ICE thing. What was it? What was my point in going there? Do I have a particular concern? What is my expectation?" Go in with that and be upfront with it and
Mm,
say, "I came because this is what I feel I need." Again, if you've had 2 consultations and you're getting nowhere, then I think,
yeah.
yeah, definitely probably time to, it might just be that your personalities don't match and it
Mm.
doesn't work, and that's okay because, we're human. There was something else I wanted to say about that. I might have forgotten. Yeah, it's gone. Sorry.
I think that's so useful though, because I think there is sometimes a worry of like, am I going to offend the GP? Are the GPs all like pals behind the scenes? And if I go and see somebody else instead of that one, like, are they going to know? Do you know? And it's like,
Thing is, you do know because your records are accessed by whoever you see, right? So if you went to see another GP the week before me and you came in and it was the same thing that you're talking about,
yeah,
seeing the nose, it does make you, oh, that's what I was gonna say actually. Well done, Karen. You've like you got me back on track. It makes you sit up and take notice a little bit more. If someone
mm,
comes in with
okay,
the same problem twice and it's not being dealt with, something else is going on, or it's just not being dealt with well enough. We need to take a different tact, go back to the drawing board, go for a different tactic, whatever that may be. Don't Your consultation is a one-off on that day,
mm,
unless you make it otherwise. Things change, with physical health concerns. You see a doctor, you present in a particular way. It's not always obvious what the diagnosis is. But when things change, go back and tell them, because it makes us, every single time we get new information, it's another piece to the puzzle. It makes us think, oh, actually, what about, I hadn't considered that diagnosis before, but I'm going to now. So you're constantly sieving the information that you're giving. So the more you go, the more it makes us sit up and say, okay, there's more to this. It's going on for a bit now. That person's not satisfied. Why is that? And it could be that that's just, as I say, from your consultation, if it's you that they've seen twice, but equally if they've seen someone else, it's also useful to know. And there are situations where, people will say things like, oh, I saw that doctor and I just didn't feel listened
mm,
to. And usually I'll just say, "Oh, right, okay," and just dismiss it and go back to the problem, because one, it does, yes, we're all colleagues, but I'm not going to just, ultimately, you're the patient's advocate, and you
yeah,
can only really speak for what's happened in the room with you.
yeah,
So I just try and kind of gloss over it, unless obviously it's, wildly
mm,
negligent or something that you have to take that complaint seriously. Um, but if it's just a little kind of passing remark, I'll say, "Okay," or it actually opens up the conversation quite nicely, because you can
mm,
say, why was it that you didn't feel listened to? What
yeah,
is it that wasn't addressed? And then it gets you to that problem, that root cause.
yeah, okay,
We hold the real reason for our vulnerability quite close to our chest, and we cloud it in a lot of other stuff.
mm,
I'll give you an example when people talk about the one that's popped into my head. I remember this lady talking about when she lost consciousness one time, and she said, I took a funny turn. I say, okay, talk me through exactly what happened. And then I get the whole story. She got out of bed, she had a cup of tea, she put the TV on, it was this show that was on, and that show was on, then somebody rang the phone, and I was like, "No, no." Oh, strip all that away. So you've gotta kinda get down, because we all hide the reason till we feel comfortable really showing that vulnerability, and I completely get that, but if you're not being heard and you feel dissatisfied, just say, you have to say. You have to advocate for yourself because we do not know otherwise.
Yeah, yeah. Thank you, because I think just that validation that it doesn't always hit the mark first time around, as you say. Your GP is
No.
a human being. They might have stuff going on themselves that day. They might have seen somebody that's just come out, they might have just had a really difficult consultation ahead of you. So it's that human aspect of, what's the reason that we're maybe not meeting each other in that space. And I love that idea of being just really clear about, like, what are your expectations, what is it that's concerning you, so that
Yeah,
we as a patient can be really clear and concise when we're coming through the door, and not getting caught up in all the waffle of what was
that's it.
happening before it and 3 hours after it, and it's like, right, what actually brings you through the door today and what's going on now?
Yeah.
Yeah.
And if you cry, it's fine. I
Mm,
think people get very worried, "Oh, I'm sorry for crying." Absolutely not. I would be concerned quite often in these situations if someone wasn't,
right.
because it's not natural.
Yeah.
So yeah, show your vulnerabilities, that's what we're there for.
Amazing. Amazing. Thank you, Susie, because I think I want to just acknowledge that if as a listener you found this episode helpful, think about sharing it, think about interacting with it. So leave us a review, leave us a comment. That's how the platforms know that this is valuable content, and help
Yeah.
us to spread the word, because I feel such a privilege that I can have this conversation with you today and get it direct from somebody that gets it, and we can tussle out the whys and what fors of what might be helpful and what might not. But I also recognise lots of people don't have access to you in their world,
I
so
know,
it's
I
like,
know, I know, I do too, but then it's a case of, like, how can you get the best out of that?
yeah.
Can I say a little bit more, Karen, about, going personally, if you've been given a diagnosis, obviously, it is my it's probably one of the things that I enjoy most in my job, which again sounds a bit morbid, but the reason is when you strip away everything else and someone knows that they are dying or going to be very soon, it just becomes real.
Yeah.
It becomes people show their true selves. They talk about the real priorities. They're vulnerable. I'm often quite vulnerable. There's been quite a lot of times I've been quite teary in a consultation, especially if it's someone I've known for many years. And then you find that out and you want to guide them through that. That's a time where definitely it's worth coming to us early. Equally, family members of someone that's been given a palliative type diagnosis, come in and let your GP know early. We
Mm,
don't want to be having these consultations when someone's in their last days, hours, or minutes of life. We want to be having them much before that.
mm,
I'd encourage everyone to talk about death more, all of us, and say, what would I want in my end stages of life? Where do I want to be? Who do I want around me? How do I want that to go? Understand it more so that when it does come, you can make the most of it with the people that you care about around you.
mm,
And that's another reason to come to your GP early, to make sure that all these process, because it does take time. If someone wants to die at home, it can't be organized really quickly. I mean, we've turned it around on a Friday afternoon. Sometimes you get the whole palliative care team out and you've got all the drugs drawn up just in case, and everything's planned and signed and sorted, and you've got your emergency numbers. But it's much better done at a time where someone is capable of making those decisions by themselves, the family are. And also, that's the kind of consultation where you don't just sort it all in one 10-minute consultation. You repeatedly see them until you get to the point where people have decided what they want to do and plans are in place.
mm.
Again, another really good reason to come in. It starts the relationship early for when family might need us at a crisis point later on.
Yeah. I'm also very conscious you and I are going to have another episode. We're going to record another conversation about that kind of palliative care, end of life.
Sure. Yeah.
What does that look like? So again, I'm just thinking, for anybody that's listening along just now and that feels relevant for them, that feels like that's in their world and maybe quite live for them just now, then that might be another episode that actually might be quite helpful to have a listen to, of what does it look like when we're getting towards the end of life. Yeah.
Sure. Yep. Yep.
I
Happy
think
to.
my key takeaways from this, though, is just that value of really getting in early, because I think that's something
Mm.
that, again, even for me, when I'm advocating that people go and see their GP, I'm maybe not doing it early enough, because I think getting
Yeah.
in before we really need that urgent consultation sounds like it's definitely best to build up the relationship, and also just being really clear about what it is we're coming through the door for,
Yeah.
and expectations we might have.
And even if it's that prolonged stress leading to an actual clinical depression,
Yeah.
you're not gonna be diagnosed with that in one consultation.
No.
So you need multiple to see how someone is over time.
Yeah.
So yeah, definitely go early, advocate for yourself, know why you're going in, and be upfront about it.
Perfect. Well, listen, a huge thank you for this
No worries.
conversation today, Dr. Suzy Peach, my guest of today. And as we said earlier on, if this episode's been useful to you in any way, please do consider sharing it, interacting with it, because it helps us to spread the word so that more people are just aware that this exists. So that's all for today's episode, and I look forward to being back with you with another episode. And as I say, Suzy and I are about to have another conversation about palliative care as well. So yeah, we might see you in another episode. Thanks, Suzy.
No problem. Thank you.